Unintended medical errors are a source of major patient harm in healthcare settings, and tubing misconnections create one such hazard to patients. Universally used connectors, particularly Luer connectors, have contributed to the risks of tubing misconnections. The most common misconnection reported has involved enteral feedings connected to an intravenous IV line via Luer lock connection. The more device connections a patient has, the greater the risk could be that a tubing misconnection or wrong route error may occur. Where an unintended administration of nutritional products and enteral liquid medications via the IV route can result in serious patient harm, including pulmonary emboli, infection, and even death. In compliance to ISO standards, Polymed has introduced its comprehensive ENFit range, including Ryle's tube, enteral feeding bag, enteral feeding tube, and ENFit-compatible feeding syringes. In an effort to prevent tubing misconnections, Polymed range of ENFit connectors discourages mating between incompatible mating lures, ensuring safe and secure enteral feeding. Now healthcare workers can establish enteral connections confidently in few easy steps. And feeding connections such as Ryle's tube with a feeding syringe or Ryle's tube with a feeding bag will no longer be vulnerable to accidental misconnects. Different feeding situations require different sizes, and that's reflected across Polymed's ENFit range consisting Ryle's tube and infant feeding tube, besides enteral feeding bags and feeding syringes, each offered in different sizes. Integrating the standardized Polymed ENFit connector system helps reduce misconnections, accidental disconnects, and incidences of leaks.